Good afternoon. My name is John Becknell. I work for an organization called Safe Tech Solutions, and this is being recorded, videoed. So now we have a mic that we can talk with. So thank you for being here. This meeting and gathering is a town hall gathering in which we hope that you'll be able to engage and talk and learn about EMS here in the county. I'm going to make a presentation about an assessment that we have conducted here in the county. And then we will open it up for discussion. And I'll frame some questions for us to talk about. And but you're welcome to say anything that you want. Town hall meetings are sort of a wonderful way in which the democracy that we live in here in the United States gets to be practiced. And the essence of democracy is our ability to disagree and have a conversation. No one goes to jail for disagreeing. Disagreement is part of how we make decisions. So I'm glad that you're here and participating in this. So as I make my presentation, please feel free to interrupt me. And if you don't understand something or I'm not being clear about something, be happy to explain more. And as I already mentioned at the end, then I'm going to open it up and ask you for your input. So great to be here. Yesterday we were in Shoshone, and last night we were down in Lander. And later this evening we'll be doing this same presentation up in Du Bois. So we're trying to cover as much of the county as possible. So this whole discussion emerged out of the fact that over the last months and over last year, there's been some concern about the ambulance service and its ability to continue on in operating the way that it's been operating. So what happened was that in 2008, my company had done some work in Carbon County, Wyoming, where we had helped some ambulance services down there reform themselves and create a joint powers authority and reorganize themselves. It was a pretty successful project. It's still going on as they struggle with many of the same things that you're struggling with here in Fremont County. But the success of that led the legislature to allocate some funds for other communities to have assessments done. So that process got started last year, and your county applied for an assessment grant, and so it was primarily funded through the state, though you put some money into it. And what the purpose of the assessment was for us to come out and take a look at how things are going, how the operation is going, what are the particular concerns, needs of Fremont County, and then to make some recommendations. So what you're going to hear today in my summary here is what we've found, our sort of major findings, and our major recommendations. So Safe Tech Solutions, we do a lot of work with rural communities all over the Great Plains and Intermountain states. We spend a lot of time studying rural emergency medical services. And have spent a lot of time looking at what works, what doesn't work. We've done some of the largest studies of rural EMS in the United States. We did a complete 18-month study of rural EMS in North Dakota, and we do work in all of the states that surround you here in Wyoming. And but our approach is one where we don't come in here thinking that we know all the answers. We know that each rural community is unique and different, and our approach is to come in, listen first, look closely at what's going on, and then put together our understanding of what is being done well in other parts of the country and what might match and work with you here in Fremont County. We call it kind of finding the sweet spot. What really is the issues that relate to sort of the socioeconomics, the demographics, the politics, the economic situation here in Fremont County, and how does that fit with what other people are doing in terms of EMS. So that's our approach. This project began in late last year, And our process for doing that was we've come out here several times and gathered information and data, and we usually gather a collection of what we call qualitative data. That's subjective data that's gathered from observation, from talking with people, from formal interviews, and quantitative data, which is gathered from looking at statistics, looking at reports, doing research, looking at numbers. So we've gathered a fair amount of material, and then we pull that material all together. 3 different consultants have been out here, and we pulled in 2 more to look at what we've been doing and done some analysis of that, and that sort of is what has guided our findings. So the full report for this will be done after these meetings are completed. So over the next couple of weeks, we will finish the full report, and it will be provided to the county commissioners. It will be provided to the ambulance service, and will be provided to the state. While the state is providing the majority of the funding for this project, they have made no requirements on us whatsoever. They have not interfered in any way, shape, or form. They have not said you have to find anything else. It is our whole findings is completely separate from them. We haven't even talked to them about that, other than they have wanted to know if we are doing what we said we were going to do. We're out here, so wanted to let you know that. So what did we find? I'm going to start right with what we found when we came out here. So the first thing that we found is that as operating today, the ground ambulance service here in Fremont County is not financially sustainable. What we mean by that is that when we looked at the way it's operating and using finances today, long term, it's not sustainable. So what you've been trying to do here in Fremont County is you've been trying to operate the ambulance with as much of a balanced budget as possible. So ambulance services collect revenues from the people that they transport. So when they go out and pick up a patient, there is a bill generated, and that bill is paid through a variety of means. Through either private insurance, private health insurance. If it's an automobile accident, sometimes that bill is paid through auto insurance, or it may be paid through Medicare, federal program, or Medicaid, which has some input from the state of Wyoming. That money is collected to cover the costs of providing the ambulance service. Now, what's happened and what has raised the issue here out in Fremont County is that we've begun to start seeing a gap between the revenues and the cost of providing these services. So it looks a little bit like this. So in rough numbers, it costs about today about $500 for the ambulance to go pick somebody up. As you can see, there's a gap between the red line, which is what we're collecting per call. So we see at least a $100 gap there. What we wind up doing to get these numbers is kind of looking at the revenues that are generated and the total expenses, and then breaking that down by looking at what it is by call. The details of this are not as important as to understand sort of what's happened here. So you'll notice we have numbers here from 2011 through 2015, and we're projecting this shortfall here in the fiscal budget year 2014-2015, which will end. What happened here was when you were back here, notice that they were pretty close. You were able to match the cost of providing ambulance service with the revenues that you were collecting. But one of the ways that we were doing that was we were able to do that by having part of our staff be volunteer, part of it be part-time, unbenefited on-call positions. We kept our labor costs fairly low. But over the last several years, as the service has gotten busier and as there has been fewer volunteers, the need to hire employees has increased. And what you see happening here in 2013, what really happened in 2013 is we woke up in 2013 and we realized that most of the employees that we had working for us were actually working enough hours to be considered full-time benefited county employees. And when the Affordable Care Act came out and made this point of looking and trying to identify who were full-time employees and benefited employees, it caused the county and the ambulance service to recognize that they needed to start benefiting and treating the people who were providing the labor for the ambulance service as full employees. That caused this jump in costs per call. So you see that it jumps up really high here. What also happened to the revenues during this time is that as we have moved forward, there's been decreases in the amount of revenues that we're able to collect from some of those providers. And also we've noticed that, and rather it happened back here, we're not sure from that historical data, but we're noticing that the mix of payers in Fremont County, how people are paying for the ambulance service, is changed, or at least it is a mix that is a struggle to be able to find this balance. I'll talk a little bit more about that later. Let me show this to you in millions. So what we see here is that today the ambulance service is collecting about 2.2 in revenues, and it's trying to keep its costs under $3 million, but even so, there is still a gap there. And that's what we're coming up to as we end this fiscal year. So one of the ways that the ambulance service has been trying to keep this gap as narrow as possible has been to decrease the services that are being offered. So if you'll know, have you been paying attention to the news around here? There's been some talk about decreasing one of the ambulance units in the last year, and then recently moving that ambulance from Du Bois down back here to Lander. So currently today, Du Bois does not have a full-time crew up there. They are trying to operate a volunteer ambulance up there, but they only have one EMT currently today and several drivers to operate that. So we have a shortage. So when we looked at how you're operating the EMS here in Fremont County, we think that the appropriate level of care for you to have, based on what's sort of a standard around the country and in other places, and especially for the unique characteristics here in Fremont County, we believe that you need to have those 5 units doing 911 calls. Those are the calls when people call for emergencies. So we're going to talk about 2 different things. We're going to talk about 911 calls today. Those are the emergency calls. Somebody gets hurt, somebody falls down, somebody starts getting chest pain, call for an ambulance. That's the 911 calls. Another category of calls we're going to talk about, and those are called transfers. Those are when somebody is at the hospital and now they need to go to a different facility. We need an ambulance to transport them. We refer to them in this business as transfers. We'll also talk about the air medical piece of this. You know that we have a couple helicopters and a couple fixed wing aircraft here in Fremont County that are doing patient transport. So those are kind of the 3 areas. When we just talk about the 911, when we talk about the 911 calls, what we wind up looking at is rather the revenues that we collect from those emergencies are able to actually pay for those services, and they're not. So we believe if you're going to have those 5 ambulance services providing advanced level of care across Fremont County, those 5 ambulances appropriately staffed and appropriately supplied and taken care of are going to cost about $4.5 million here in the county. So currently you are collecting revenues of $2.2 million. So you can see you have a pretty big gap there. Okay. Yeah, so here's where we're at. We had lots of different budgets come through across our table, and we took some. We had to pick some numbers. So we picked that we're in the ballpark, and what is really important to us, Scott, is this gap, and the gap that we have is what and whether the numbers are off a little bit, there's no dispute that we have a gap. Uh-huh. Yeah, so but when we project out and when we project into 2015, we're concerned about whether you'll be able to maintain that. And yeah. And so as we've come up with this gap, one of the things that we want to understand about that is how that will impact services going forward. So one of the ways we're trying to handle that gap, as I've already said, is we're trying to reduce the costs, and that has caused us to pull back on the amount of ambulance service that we're deploying. And if we continued on this path, it may require that we even cut back more ambulance service. So that's why we come to this conclusion that it's not sustainable. So currently, back to this projection, if you have the services that you need going forward, it's going to cost you about $4.5 million. And today, those revenues are not going to match that amount. And so that creates a concern for us. So that brings us to our next finding. Our next finding is that as you're operating today, you really need the ambulance service here in Fremont County. If there was any place in the United States where out-of-hospital emergency medical care is really needed, it's here. You have 9,000 square miles, you have 40,000 people here in the county. About half of them are barely packed in here in the Lander, Riverton, Fort Washakie, and Ethity area. But you still have a large number of people scattered across the county. What that means is that when you call for an ambulance, often it takes a long time to get out there, and it takes a long time to get the patient back. And to provide the level of service that's needed to take good care of people, we believe that advanced levels of care work real well in that kind of setting, where you have long transport times. Along with that, you have a geography and a climate that sometimes makes response and the ability to transport people slow. Another thing that is going on here in Fremont County is you struggle with some pretty heavy healthcare issues. You have a large number of a large amount of trauma. You have a lot of what we call medical or healthcare issues related to diabetes and heart conditions. And when you're ranked in the healthcare rankings, you rank really low. And that means probably that a lot of people are struggling with finding and getting preventative care and so on. But what that means from an EMS standpoint is that this service is critically needed. This is something, and it's part of the quality of life out here. Just imagine if you didn't have it. So currently that ambulance is going on about 5,500 calls a year. And it's been slowly rising, not dramatically, but about 5,500 calls a year are out there. And with that number of calls out there, amount of resources that you have here is probably just barely covering that. And we'll talk a little bit more about that. But EMS is needed. This is one place. And interestingly, when we go around, rarely will you find anywhere in the United States where you have a county this big and where other resources are so far away. The interesting thing, and happens in other rural communities, is if an ambulance isn't able to go or it's already busy on another call, you have mutual aid agreements in which you're able to get an ambulance from another community or another county to come. But because Fremont County is so huge, and you guys here in the Wind River Basin are so far away from other places, you're really it for EMS here. You really are there. And the other piece about it is that because of your geography and because of the climate out here, you're always going to need a really good ground service. There's going to be a lot of times in the winter when helicopters aren't going to be able to fly, when fixed wings aren't going to be the answer. You're always going to have a reliable ground ambulance service. So with minor adjustments, the current ground operations are operating appropriately and effectively. Here's what we did. We took a look at how your ambulance service is working today, what they're doing in terms of placing ambulances, training the crews, putting them out there, and what we found is that they're doing a good job. There's a few things that they could tweak that are just part of the ongoing adjustment to make sure things are operating well, but we are surprised. We often in rural areas don't find such well-run ambulance services, and we were quite impressed. Records were good. As we looked through the data, the way they're operating, the way they're staffing, all of that seemed to match the need here in Fremont County and match what is sort of best practice around the country. So as you're operating today, you're doing it right. And the whole idea of where you originally, before you've tried to close the gap by pulling back ambulance services, having the 5 ambulance full-time crews, one in Du Bois, 2 in Riverton and 2 in Lander, is when we look at the call numbers and we look at where those calls come from, it's the right deployment. And it's being done well, and we're actually quite impressed with the people running the ambulance service here in Fremont County. So our fourth finding is that the 911 ground operations can't be funded on the 911 transport revenues alone, and on the Indian Health Service contract. So remember I told you about where we get these revenues from. So here in Fremont County, your main primary sources of revenue are from private payers, from private insurance, from Medicare, Medicaid, and an Indian Health Services contract. When you put all of those together, they're not going forward going to cover the costs of 911 transport. Now, there's nothing unusual about that. In most places in the United States, especially most rural places in the United States, the revenues collected for 911 transports do not cover the costs. And so consequently, the 911 services have to be subsidized by something else. And so the subsidy that that has provided that over the years for you has been a subsidy provided by donated part-time or or on-call kind of labor. So we'll talk a little bit more about that. The IHS contract. So currently there's an IHS contract that provides about a little bit more than $400,000 a year in terms of revenues to the ambulance service for patients that are under Indian Health Services care. And that contract is out of date and should probably be worked toward being renegotiated, but here's the deal. With the challenges facing Indian Health Services, even with fixing that and improving that is not going to fix this problem. That's not the full problem. The full problem is that it's difficult to fund 911 transports off of 911 revenues alone. So, fifth finding. The EMS system in Fremont County has always been subsidized and will always likely need to be subsidized. So here's what we mean. So this ambulance service emerged out of some local volunteer ambulance services that were developed in the 70s and 80s around the county, and then they all came together under one umbrella in the county. But the way we were able to make those ambulance services work was by using donated labor. So when rural EMS was created in the United States, and modern EMS, we look at it as sort of developing. It kind of comes on the scene in the mid-60s. Those of you that are older remember when there was that television show Emergency on, and Johnny and Roy. Well, that came out in 1969, and that was at the very beginning of sort of modern EMS. We trace modern EMS back to 1966 in a paper from the National Academy of Science that said you had a better chance of surviving being shot in Vietnam than you did getting in a car accident on a rural highway here in America. So, and we started investing money in creating ambulance services. The federal government put a whole bunch of money in to EMT training. Back in the late 60s, early 70s, you could get federal dollars to put together a training program. You could buy equipment with federal matching dollars, and so on. One of the things that we didn't do, though, when we were trying to create this system was figure out how to fund it. No one sat down and said, how are we going to fund this in rural areas? And so the revenue system that I talked about through private insurance, Medicare, Medicaid, so on, sort of evolved on its own. And no one ever sat down and figured out how to do it. So what happened was rural communities said, how can we do this? So what's the biggest, largest cost of any service business? Labor. So what we figured out to do was we figured out that we could donate that labor and keep the costs of operating these services fairly low. And it was a good time. People wanted to volunteer. People wanted to help out in their communities. And so they would volunteer, they would get the training, and they would be part of the ambulance service. Yep. Yeah, so the discrepancy is between the money that we're able to take in and what it costs us to provide the service. Good question. So her question is are these additional costs, this rise in costs, really related to the cost of people, of staff, of workers? And the answer is yes. What's happened is that we've now had to pay people increasingly more because the ambulance service has gotten busy. And what we were able to do for 30 or 40 years here in Fremont County was to actually run the service by subsidizing it with donated labor. So what happened? What happened to the donated labor? So I can't speak specifically to what happened here in Fremont County. I wasn't here, but I can tell you I've worked in hundreds of communities across the Great Plains and Intermountain states, and I can tell you as we've studied them what's happened with volunteerism. What's happened with volunteerism is that there has been sort of a perfect storm of changes. One of those is that it has cost more for people to earn livings over the last 25 years. So often more people in a household have to work more jobs. So whereas maybe 30, 40 years ago we could get by on one income, now more people in the family are having to work. That means there's less time to volunteer. And as things have changed in rural communities, people have had to go further for those jobs. So often people are commuting and driving long distances in rural communities, whereas years ago when we had more local ag business, more things local in our communities, jobs would be local. But now often people are driving longer distances. Again, taking more time, having less time to volunteer. Other things that have happened is that what we've seen is what we call the Walmartization of rural America. And what we mean by that is instead of people being able to shop in their own local communities and get to know people, so they might shop at the local grocery store and buy things from Howard there, or they might go down to the hardware store and buy things from Bill at the hardware store, and they might see Rosie at the local pharmacy. That doesn't happen anymore. People are driving distances and shopping in big box stores and checking out with a checker that they don't even know, and nowadays we don't even have a person in some of the places when we check in. So we don't have that same sort of connection. So whereas grandma and grandpa and mom and dad had more connection to the community, the younger generation doesn't have that same sort of sense of duty, loyalty, and belonging in that specific community. The other thing that's happened is that as EMS has continued to evolve, the qualifications and the requirements for those working on the ambulance continues to increase. We're continuing to discover new ways of taking care of emergency patients. We're bringing on new equipment. We're bringing on new modalities, new skills all the time. And the levels of being trained and keeping up with that are going up. At the same time, our expectation for accountability and performance is going up. We are scrutinizing what those EMTs and paramedics do much more than we ever have in the past. And for us to get paid, we are demanding that they be very precise in how they take care of patients and then record that. Medicare, Medicaid, insurances are all basing their revenues on whether this was a justifiable event. And so we're asking that those providers do much more. Also here in Fremont County, the call volume has gone up. If you look back over the last 20 years, you've had a fairly significant rise in the number of calls here in Fremont County, demanding that those people who are working on the ambulance put in more time. The other thing that's happened is that we have regionalized healthcare. So the hospital here no longer is an A to Z kind of facility that does lots of things. For the best care for cardiac patients, or the best care for orthopedic patients, or the best care for obstetrical patients, we've regionalized those care, and so many of the patients now have to go further away. And if the ground ambulance here was doing all of those transports, just imagine how many hours they would be on the road. In many rural areas, it's the transfers for the volunteers that are often killing them because of the hours that they have to invest. So that's created sort of a perfect storm of people saying, I'm not so sure I want to volunteer anymore. And as they've done that, they've also begun to look more critical at the model. They begin to say, well, wait a minute. If EMS is an essential service in our community, like law enforcement, like education, like road maintenance, why are we expected to volunteer and these other people providing service in our community are getting paid? So there's been a questioning of that, and people have said, you know, I'm not so sure I want to put in as much time free. And so increasingly all over the United States, even where we do have volunteers, we've begun to compensate them. We've begun to give them stipends. We've begun to give them call pay. We've begun to give them pay per call. So here's what I want you to get out of this. The subsidy for the ambulance service has always been here. That subsidy was just borne by the people who were volunteering. So there were maybe 20, maybe 30, maybe 40 people around the county who were shouldering the subsidy for the ambulance service. So now as that goes away, what the sticker shock is for us, as we moved in 2013, 2014, we moved all those employees to being benefited, paid employees. What that means is that we're facing sticker shock.
How the system was subsidized previously. There has been no county subsidization. To this point, there has been no county subsidization of the system. There was a 165,000 supplement that was given last year's budget, but the county has not subsidized any of your taxpayer funds Not fair.
Yes. Yeah, so the count, at least in our findings, the county stepped up various times for some capital expenditures and things like that. But in terms of paying operating expenses for the ambulance service, and that's what we're primarily talking about here, operating expenses for the ambulance service, it has not been. So it has been subsidized by the people willing to donate the labor. Now that they're not willing to donate the labor, the question for us here in the county is, how are we going to replace that subsidy? Should we reduce the amount of services that we provide, or should we find some other way to replace that subsidy? Question? So we'll hang on to that and we'll talk about that. Good question. She asked about rather unpaid internships.
What effect would the elimination of the Unaffordable Care Act have?
Well, actually, it would probably not have any impact, to be honest with you. It would not have any impact because the only thing that the Affordable Care Act did was it actually made the county face what was going on already. That you had employees that were increasingly working more and more hours, but they weren't benefited. And what this has done, it was just a way of recognizing what was actually being done. So even those employees were still subsidizing the ambulance service in their unbenefited nature. And I don't think long-term, from a labor standpoint, that you would be able to roll that back. And I think that would have come anyway. I think the Affordable Care Act just forced our hand.
Isn't the Affordable Care Act, rather Unaffordable Care Act, is that some of the expenses?
It has gotten more people insured. So the Affordable Care Act, it's projected long term, should begin to help out emergency services on a couple of fronts. One front is that if we have people who actually have insurance, there is a possibility of getting some payment from their private insurance. The second thing, and there's some question about whether this is really working out sociologically, but the question is the theory is, if people have insurance, they will be more preventative in their cares and will need emergency services less. All of this is still being played out, as you well know. We don't know what the outcome of that's going to be, but I think if they could repeal the Affordable Care Act tomorrow, it would not fix your problem here in Fremont County. It would not change that. You'd still have this problem. So a couple more. Volunteerism is no longer a long-term reliable means of subsidizing the ambulance. We just described that. And the Fremont County Commissioners have been very strong in wanting to minimize the public subsidy of EMS. So one of the things that they have been very dedicated to is making sure that tax dollars are not going to pay for ambulance at this point, because there was no plan for that, and they have wanted to see if the ambulance service could operate on the revenues that it collected and not be subsidized by public monies. So we looked at our assessment with that in mind, and we looked for a variety of ways of doing that. So the last of our findings is that the EMS system in Fremont County can be redesigned to be provided at a low or no cost to the taxpayers. But this process will take 2 to 3 years, and during that time, EMS will need to be subsidized by public money. So let me explain that a little bit more deeply here. I want to go back to this. So it's the right thing to do whenever your government's going to do anything, to want to make sure that you get the best value for the least amount of money, right? So we know that we need to hold government's feet to the fire to make sure that that happens. So that's good thinking. So we heard two big messages when we did our assessment here in Fremont County. The two big messages we heard is that the people want a robust EMS system here in the county. We spent time talking with lots of ordinary folks here in the county, and this is part of it. No one told us, let's eliminate the ambulance service. People said we need it, And when we talked to the people at the hospitals, when we talked to the healthcare providers, they said the advanced levels of care are important and critical in saving lives here in Fremont County. So we heard this big message that a robust EMS system is needed and wanted, given that. But we also heard this message. We heard this message to minimize the financial burden on the public. So as we looked and studied this, we think that you can do both of these things, but not right away. So here's the caveat. We don't think that you'll be able to fulfill both of these immediately. You can do a couple of things. You can cut services to match the revenues that you have, but that's going to take more ambulances off the road and have fewer response, and people are going to be waiting longer and longer for ambulances. Or we can begin to subsidize the ambulance service and then look for ways to do something different. So let me explain. I'll get to our recommendations. So here's our major recommendations. The first recommendation is to clarify what role the county desires to have in ensuring the delivery of EMS here in Fremont County, and what the residents want and what they're willing to pay for. Here's an interesting thing, and that's a good thing of why you're here in a town hall meeting. There is no requirement, there is no mandate in the state of Wyoming that Fremont County provide ambulance service. You don't have to do it. There is not a mandate. The county ambulance service, Fremont County EMS, has a license to operate an ambulance, and the state regulates ambulance services, and you can't operate an ambulance in Wyoming without a license. That license requires you to operate in some very specific ways under a set of rules, but there is no requirement that you have it. Fremont County does not need to be in the ambulance business. You can get out of the ambulance business if you wanted to. So one of the things that's about these town hall meetings is an opportunity to understand that and say, what role do we want our county to have? Do we see EMS as an essential service, like we might see law enforcement, schools, road maintenance, other things? Do we see it as an essential service, and do we think the county should be involved in ensuring that there is some level of service provided and that it's at some level of quality? So we think that is what's happening here. We think this recommendation is actually being worked on right now. There's county commissioners sitting here in the room today listening, participating, and we think that having this discussion is the right discussion for you folks to be having. What role do we want government to play? And the interesting thing is that we probably won't all agree, but what I hope you can do is have a healthy discussion about it, and that we can talk about it, and usually out of healthy discussions is where we find some of the best stuff. So clarify the role. The second recommendation that we have is that you subsidize EMS to operate with 5 ground units stationed with 2 in Lander, 2 in Riverton, and 1 in Du Bois for the next 24 to 36 months. In other words, from a county standpoint, provide the funding that's needed to operate 5 ambulances throughout the county. So we believe that's the most safe and humane thing to do right now in terms of taking care of people and meeting those 5,500 calls that are coming in all of the time. Third recommendation is then during that 24 or 36 month period, create a system design that maximizes efficiency. So here's what we mean. What we mean by that is start redesigning how EMS is provided here in Fremont County to find some efficiencies that can actually reduce whatever you might have to subsidize it. So let me explain that a little bit. There are actually quite a bit of money in EMS here in Fremont County. How other systems subsidize the 911 part of EMS is they integrate it with the transfers. I told you I was going to talk to you about the transfers. The transfers, ground transfers to other hospitals and so on, the ambulance service, the revenues for that and the return for that are much better than they are for the 911 business. So transfers often often bring in more money. Correct. So across the United States, the rural communities that are doing this well, what they're doing is creating integrated systems that take care of the transfers, that integrate ground operations with air medical operations, so that the pot of money is spread out. So remember, I told you 911 is always going to need to be subsidized. So if you look at the number, so something I haven't told you yet is there's about at least 50 or so transfers being taken out of the Lander Riverton hospitals each month. And currently, the ambulance service does not have enough staff and enough resources to do those transfers. So those transfers are largely being done now by air medical, by fixed wing and by helicopter. I wasn't able, because couldn't get access to patient care information. That's illegal. We weren't able to look at all of those transfers and find out what percentage of those transfers could be handled by a ground unit. But we're guessing that it's probably greater than 25%. If those transfers were done by ground, that would bring in more revenue, that would help subsidize the 911. Now, if we integrate the air medical is actually, so why would you imagine in a place in Fremont County where the ground ambulance service is struggling to pay its bills now that it has to pay full-time staff, why would you have two private air medical companies here? The reason is it's profitable. The fee schedule for paying air medical services is much greater. So the national average transport by air medical, the collection on that is, or the bill, let me say the bill, what is billed, a national average is about $42,000. So the average bill for a 911 transport here in Fremont County is probably around $1,500. So notice the difference. Now, their costs are much higher. It's very expensive to run helicopters and airplanes. But there also wouldn't be two companies vying for those transports here in Fremont County. We suspect that the transport revenues from air medical here in Fremont County are worth somewhere between $8 and $20 million. Those companies aren't telling us what they're collecting, but from what we know about operating those services and working with them in other places, there is a fair amount of money in the pot. So one of the ways to create a system here in Fremont County that has a low or no subsidy is to take some time and carefully create a plan. And so why I say this with so much confidence is that this is being done successfully in rural areas around the United States. And there are models that we can show you. There are places where this is actually being done. Here's the deal. You're not going to be able to do it overnight. That's why it's going to take that 24 to 36 months. And you are coming up to a budget, an end of a fiscal year here at the end of June, and you have some decisions to make. So notice the list up here. So how might we begin to create a system that reduces that subsidy? The first part is to using an outside firm or someone with experience from the outside, and we've recommended some people who have experience in building high quality or low or no subsidy systems. Then employing some best practices in your area of billing, staffing, and employment and deployment. Start making sure that that your costs are exactly what they need to be. And then maximize the billing so that we can get as much revenue as possible. So we've looked at it, and we don't think you're going to get too much more, but you're going to get some. Then start maximizing the ground transfer opportunities by integrating with the hospitals and the transfers that are going out. Right now, the hospitals are a little bit unhappy with the ground ambulance service here because you've cut back resources. You only have 4 vehicles now to deal with the 911, and you rarely have vehicles available to take long distance transfers. So they've just sort of shifted automatically, giving those transfers to air medical. Then maximize the IHS contract, integrate with the air medical services, and one other suggestion part of this is to work with the state to reduce the barriers to recruitment. The state has some rules for recruiting people out of state and getting workers here that need to be changed. And we've been pushing on them to do that. We know that a rule revision is underway and has been completed and is before the Attorney General for review at this time. Doing this will begin to create a system that is sustainable and doesn't cost you a lot of money.
How are the air services able to collect such higher revenues when the ground service is having difficulty collecting their revenues?
What happened? Yeah, where's that mismatch? Yeah, it's a good question. So what happened is that back in the late in 1999, 2000, 2001, 2002, there was a whole process that went on to sort of figure out how to pay for these, and through Medicare, CMS, and it's called the fee schedule. And there was a process called negotiating rulemaking that put that in place. The air medical industry got together and they separated themselves from the ground business, and they negotiated a much better rate with Medicare. Now, private insurance often uses Medicare as sort of a benchmark of what it's going to pay. Now, the air medical services they understood their costs, and what they negotiated was a cost-based kind of reimbursement schedule. And the ground ambulance services didn't do so well. They tried to do a cost study, it failed. They tried to get together, and there was just too many of them fighting. You have to know that EMS across the United States is actually fairly complex. We have it being provided by hospitals, you have it being provided by fire departments, you have it being provided by private for-profit companies, private not-for-profit companies, and third services like here, a county providing it. So they weren't able to get together, and so they created this fee schedule. So there's actually a plethora of air medical services across the United States, and many venture capitalists have gotten into the business because it's very profitable to be in that business now.
One of the things they did was they set up a special air flight insurance program that people could buy into. Has that ever been tried with the ground service?
It is, and there are some models with it. There's actually an ambulance service in Louisiana that does a lot of that, but what they have found is they have not, in most locations, we've not found the sweet spot in terms of what we would charge for that subscription or that membership that would actually make that work well. It's been tried a lot of places, but it hasn't been the sort of fix that has saved ambulance services. It works well for air medical, but it hasn't worked well for ground. So we have a fourth recommendation, and it's this. When this third recommendation is in place, and when you start doing this, then reduce or replace any tax subsidy that you've created for that 24 or 36 months. Now, the obvious thing is this question of, boy, if we have a tax, will they ever roll that back? And that's certainly something to think about. But I think you're going to have to subsidize. I think you're going to have to subsidize in some way, shape, or form. There is some thought around the county about, should we just sell the ambulance service? And the air medical services have expressed some interest in buying the ground service. And privatization is certainly an option that may come out of this. It may come out of this that you actually privatize the ambulance service. But here's our caution. Our caution about that is that is to take action but go slow. You want to make sure that the decision that you make allows for the fact that EMS is vitally important, and you want some control on assuring that when a call comes in, you're going to have the services that you need, and that private EMS providers can certainly do that well. But the systems that seem to work best are the ones where there is oversight and where you don't just give away all control of it. So many systems where private EMS contracts to provide those services, and then an entity over top of them, an authority or within the government, provides performance measures and requirements that the private provider perform at a certain level. One of the questions is if you just lock, stock, and barrel completely privatize, if that private business starts to have trouble and they decide to pull out, let's say that the air medical reimbursement goes down, and most of us who are in this business clearly expect some fairly significant reduction in air medical reimbursement in the future. So if you sold it to a service and lock, stock, and barrel, and then that business failed, then you're going to be stuck. And the startup costs for restarting up an ambulance service would be significant. 10, 15, $20 million it may take you to restart up an ambulance service. The other concern that we have is a concern, and it's a workforce concern. Today, you have a great group of people who are working super hard. They're working a lot of hours. In fact, they're working tons of hours. And you will probably need a larger workforce in the future. And one of the key things is that you want to make sure that this service keeps good people working in it and that they're motivated and want to be here. And the uncertainty of where the ambulance service is today and what's going to happen to it in the future is hard on the workers. They have families, they have futures, and they're wondering what's going to happen. And so as we move forward, being able to attract a good workforce of skilled, competent EMS providers here in Fremont County is going to be difficult because of the geography and how far you are away from large metropolitan areas and so on. There's also another thing, and that's part of that bottom little thing there, is that you're going to need here in Fremont County to do some workforce planning, and we're hoping that the state will reduce some of the barriers to you having more of a developmental program here where you can start growing, creating, educating people from basic provider all the way through paramedic. That would be a long-term sort of goal here that would be really good.
Another question. Why is the Indian Health Service not paying enough to cover the cost of reservation?
Well,
what is
the short answer is I don't know. But what I do know is this. I do know from having worked in a lot of other areas that that negotiating that contract is a process that needs attention and needs time. And Director Zillmer has been here a short time, and he has done lots of things, but one of the first things he recognized was that contract needed to be renegotiated. And that is a long process. It actually needed to be negotiated probably 4 or 5 years ago, at least 2 years ago. And so that's why it's up there, maximizing the IHS contract and finding that. So that, and he has put out there, that is a hard road to hoe because IHS funding federal funding has been reduced, and so
Said, are having
we est
Some of those problems out.
we estimate it's probably only covering probably 40% of usage. Don't know that for sure, but that's what I'm guessing or estimating. There is some talk on the reservation. There's a good group of first responders out in Ethity, and we met and talked with them, and they would like to start an ambulance service. And there are Indian Health Service ambulance services in other locations. I don't know if that's possible here. I would not count on it. I did not see a business plan or any sort of documented process there, and I would not count on it until I saw a reasonable business plan that had been drafted out to do that. But certainly using those resources and finding a way to maximize those resources to work forward, I think is part of the plan.
Indian Health Service. Better pay. It's close. Problem is,
They
Which-
wouldn't do
no
that.
matter which branch or where it happened.
Doctor, would you explain the payer mix?
Yeah, good. Thanks for reminding me that. So one of the things that's interesting here in Fremont County is that we're something we call payer mix. So that means, where do you get these transport revenues from? Do you get them from private insurance? Do you get them from Medicare, Medicaid? So in most rural areas, the mix between those that are provided by government, which would be Medicare, Medicaid, Indian Health Services, is about 70% of the pie, of the revenue pie, and 30% is usually private insurance. So private insurance typically pays quite a bit better than the government programs. So here in the payer mix here in Fremont County presents a challenge. So you have about 90% who are getting some sort of government sort of paid revenues, and 10% private pay. So typically you would use that in normal, where it's 30-70, in another rural area where it's 30-70, you would use a portion of that 30 private pay to help subsidize the shortfall that you had on the 70% of the government pay. So here you have that additional sort of challenge in terms of providing the services here, or paying for the services. Did that cover it? So there's some questions I think that are kind of key here. One is this question about what level of EMS services do you want? How much of them? Is EMS an essential service that should have government involvement or oversight? Would you be willing to pay in additional taxes to fund EMS here? And there is what we already talked about, this immediately privatizing EMS in Fremont County is certainly a possibility. And I think these are some of the questions that we should talk about. So I'm interested in your thoughts, feedback, other questions. Try to give you a thumbnail sketch and some background.
I understand there has been some proposals for privatizing it, and already some companies made proposals, started to. Help us on that, Travis?
At this moment, they've shown interest. We have not accepted anything at this point because we, as a commission, have not finalized what we were asking. It'd be kind of hard to, I guess, say, hey, shoot us a proposal when we have no idea whether it's going to be privatization, whether it would be a mix. Hasn't decided how to form the question, whether we're asking for RFI, request for information, or total RFP.
I understand that there was a thought of going step at a time into the possibility of privatizing, by, have the equipment, privatize the service itself, let it go for so many years. So if the privatizing of failed, the county could step back into it rather quickly compared to.
There's a lot of different models to look at with that. There might be, I'm just speaking for myself, could be that we go to a model of a contract for service. Some entity, whoever that is interested, we as a county own and operate the equipment. Maybe we get a lease payment. We fix it up as a lease payment from, that's an option. There's hundreds of options to look at. Any kind of model that you're not limited to just saying one thing or another. There's a wide range of possibilities.
That's my. Invested in
So that's why. Hold on just a second, let me get her first. We didn't. What years was that here? Huh? Does anybody have any sort of memory? we didn't look in back that far. But again, hear me clearly. Privatization is certainly an option up there. Our recommendation is just to make sure that you take your time and do it carefully, so you understand what you want to do and how to make sure that you protect yourself in terms of going forward, and that there isn't a day when somebody needs an ambulance and it's not there. So
they're not making they give you
well, there's no saying that they won't come back to you for a subsidy. If this is happening in other places where there's private providers. So
are they not?
So that's why we think, and our recommendation is that you pause, and that you take some time, that you subsidize the ambulance service here, and then work toward creating. We can show you systems where the subsidy is very low, but they are integrated systems that have been carefully designed and carefully constructed. You're not in some place that you shouldn't be. This is just a natural evolution of the decline of volunteerism, the increase in ambulance volume, and the changes in emergency medical services and the betterment of them. And this is just a good discussion to have, but it's one where you want to take your time and make sure that you go into it with eyes open.
Take a look at the other side though too. If it's privatized or go into it and do it carefully, those people that run that are going to be looking to make a profit. They will put more effort into making it worthwhile, and that doesn't necessarily mean increasing the cost, because if they increase the cost too much, they're going to have competition. And that's one of the things that made this country run: competition. Privatizing, you know,
Yeah, I'm going to get your question because I know you have it, but I don't know that a private provider would want to have Fremont County if they didn't have an exclusive franchise. That would be part of the design problem that you would have to do. I don't know anybody that would want to come in here and provide private ambulance service without some exclusivity. What was your question? I don't know exactly what that is, but here's my estimate. My estimate is that probably 25% of those could be handled by ground. That would be a revenue generator. If you were able to put on extra crews, so you would need to put on some extra crews to take those, you would be able to take some of those. Those would generate some revenues. Then there would be a certain number that are left for air medical. And probably what's left would serve probably one helicopter and one fixed wing. You probably, if you take out the ground transports, that you would probably have what was left probably only would support one helicopter, one fixed wing. But when you build the whole system around that, it is much more sustainable rather than continuing to fly everybody out of here simply because you don't have ambulance service. My concern about that is that eventually Medicare, Medicaid is going to maybe question that. There's a lot going on in scrutinizing the cost of air medical right now. So that's why we would say build an integrated system that does something with all of those pieces. That's for the grant. That's simply 4.5 million is what it's going to take to have a robust 5 ambulance 911 transport system here. So you'd have 5 911 And then you would probably add on, as you looked at the numbers, add on transfer vehicles. Maybe that would be a 12-hour shift during a day. That needs to be studied in real detail, but that's how the systems work. Sure. So you would also gather some resource by getting back to 5 full-time crews, and there's going to be a little bit of opportunity there. Right now, you just have absolutely no opportunity to do any transfers at all with 4 crews.
private insurance. Mayor's gonna. Federal involvement model that 70, 90% of our money comes from federal subsidies. Will model their bills based on Medicare. Private insurance allowable on this.
So one of the issues, though, I appreciate what you're talking about, because you're talking about cost shifting. And yeah, so that's why this is such a great conversation. I mean, it's wonderful that you see through that, and you're asking that question, and that's a question I think you have to ask. So a question comes down to, so what we're talking about doing is doing what's happening in a lot of areas where we're using the whole pot to subsidize the emergency 911 part. Now, a question you can be asking yourselves here in Fremont County is, how do we want to do that? Because you can simply keep the 911 piece, and you can subsidize it so that you can provide what it is, but just know that there will be a subsidy associated with that, that it's not going to cover its own costs. And this is why we're asking you to slow down, to ask yourself, how do we want to do this going forward? What's the right thing that works for us here in Fremont County?
What was the
I'm not sure which one you're talking. Yeah, this is just what this whole idea of. Right. So we were working with a county, and the county commissioners said they didn't have any money to help subsidize EMS, and they said that because they were having the same decline in volunteerism, and they said there's just absolutely no way to pay for this, and so we came back to them and said. We said, well, let's look at your budget. And we looked at their budget, and we came back to them and we said, so we have a solution for you. You can pay the labor here, and it'll be cost neutral. So see this line item in your budget here for labor for snow plowing? So we take that amount of money and drop it down to the EMS line to help cover labor there, and we'll just make snow plowing volunteer for the next year. And they laughed, and we did it as a joke to talk about this whole idea of often it's about priorities. So we wouldn't think at all about making certain parts of government volunteer. It's just that the way this developed, it was volunteer, and now that volunteerism has gone away. So a question for us is really back to this thing is do we see it as an essential service? If we do, what portion do we want to have in it? If some private provider can come in here and wants to do it, there's private providers. Some of the air medical companies want the ambulance service here in Fremont County. They want that, but I haven't seen any proposals from them on how they might want to do that. What they would do? Would they make the ground BLS? What would that be?
I had I am not privatization. I've seen I have me often for private companies. I 60%. They're concerned. Privatized. How much will I have help?
So,
I benefit as a county. Much. I'm not saying it. Models that is a concern. That obvious discrepancies. How will it be? Without that. That is.
yeah, being because of where you're located. The other questions. So in the other, oh, did you have some? Okay. In the other town hall meetings, some of the issues came up. Some questions came up around if we do need to create a tax, what's the best tax? So that you have some options in terms of sales tax, a health district, property taxes. There's some various things. One of the things that folks asked for was they asked for could we have a summary of what some of the options and might be in terms of that, and what would be the implications for various constituents in that. So there was that came up, and there was some talk about possibly doing that or seeing if there could be some way of presenting that. The clerk also pointed out that decisions have to be made fairly soon in terms of what the county is going to do moving forward, because the budget year ends soon, and that it will take some time to pass a tax, and probably if they could pass even a sales tax in November, it would take till well into 2016 before any of those revenues were realized. So there are some challenges, but what's great is that you're having this conversation. I think that you guys are getting lots of information and lots of feedback. And did you have any other things you wanted to mention? Okay. Any last comments? Sure.
My comment was that since EMS is an essential service, as you mentioned, like police and fire, and that fire gets county subsidy through a mill, don't they? Or
There's a mill levy, but it's not a subsidy.
no, well, that's terminology, but they are from the taxpayers through the county for mill levy. If we're willing to do that, and we're willing to do Same thing for museums, recreation districts, tax notices for these mill levies and stuff. I think we should at least do a portion, a mill levy of some sort to help in the interim cover EMS, since it is an essential service and the county is willing to use money for these other services too. That should be on the table.
Can I speak to that real quick? Just so that you're aware, I think I can use this one. The options that have been discussed, first, sales tax. Sales tax or property tax or a mill levy, health district, whatever may come up, has to be submitted to the county clerk by July 17th, I believe. That will not be on a ballot until November. If, and again, a big if it passes, the first collection will start with sales tax. Sales tax would not start collecting until April 1st of the following year, so 2016. Those monies would not hit the county until June, because that's the lag time between sales being collected and turned into the state, and then they turn it back over. So you're over a year at this point on a sales tax. On a property tax, add another year, because you know how the property tax stuff works. It wouldn't go in effect till the next year. So you're in some cases 1 to 2 years out on those. Right. There.
Trouble with the taxes that we can't guarantee pass. At these last 3 meetings we've had, about half are adamant they don't want it, and so we put sort of all our eggs in one basket, counting on say the 1 cent tax, and it fails. We're back to being 2 years behind it, no matter what we do. So that's part of why we're here, is so we can get an idea of what the consensus is, and hopefully we're going to have a survey out with some ideas where we can get a bigger population to come in and give us their ideas, what they would like to see. But as far as counting on a tax passing, that's no guarantee, and like I say, then we're back to square one.
Having some sort of a tax subsidized EMS, what are they suggesting? Have they told you?
The others are just out in limbo. I mean, they don't like the tax, they don't like the mill levy, they don't know enough about the health district, and so on and so forth. So there again comes up to informing the public so they can have somewhat of an educated opinion.
Are all in.
So what we have heard is, and is that we have not heard people saying the service should go away. So that, remember those two messages. One was we want a robust EMS service here in Fremont County. That other message was, let's see if we can do that with as little burden on the taxpayers as possible. So that's really what the question is here. We think that with some subsidy, I mean, this is not waiting 24 or 36 months to do something. This is putting in action right away and actually getting some stuff done to move toward that in our recommendation, that you start planning right away. And actually, you're doing it here. This is really the first recommendation that's happening.
The other thing that you haven't touched on that you went over very significantly in the previous two meetings was that we know that there's a different cost for the level of care. We know that basic services are going to run about 37% lower than a paramedic service, maybe 40%. I think you need to address a little bit about the morbidity mortality part of this and your recommendations on what you believe the county should have, because that question is coming up continually. I don't understand what a basic is. I don't understand what advanced life support is. So I think you need to give a couple of minutes to that so that those that are here that may not be aware of that portion of it at least have a general understanding.
So we think that you should have advanced the level of care that you have now, which is what we call advanced life support. Advanced life support is a level of care that enables the provider to take care of the patient with using advanced airway ways to make sure that patients can breathe, medications, advanced care of cardiac patients, those sorts of things, and it allows them and advanced life support is really needed where you have long transport times. The challenge is when you have a long transport time and you have a really sick patient or a really badly injured patient back there, you want to give them as much chance as possible. And advanced life support, while it's common in urban areas, we often talk about what we call a paramedic paradox. We have paramedics in the United States where we need them least, where they're closest to the hospitals, whereas out here is where we really need them. So I think if you want to take good care of people, could you get by with basic life support? Yes. Will there be some lives lost? Yes. But we are always making those decisions. We make decisions and we do trade-offs, but certainly you want to do that decision with your eyes open. And state of the art right now and what is being done in other areas is to provide advanced life support. And we think ground should be advanced life support. It's the backbone of this system. The helicopters can fly here, but you have lots of weather when they can't fly. And when there's no helicopter going out there, it's going to have to be ground. And the ground, especially in the inclement weather, is going to take a long time. You know, driving a patient 80 miles, 60 miles in a blizzard is going to take a while. And being able to afford and provide the level of care that you're providing now, I think, is important. Let me get him, and then I'll get you.
A comment to the ALS provider option. I think that before we even have this discussion, is we need to have the mortality rate of what it was like when we just had volunteers and basics going through here versus the mortality rate we have right now. Then after viewing that as a public, then we should be able to go forth and make that decision. But I don't think we need to make that decision with any false pretenses or hopes of what certain scopes or practices paramedics, EMTs, and intermediates can do.
That's a great idea. The challenge with that is that we don't have clear numbers. So being able to compare to what you had before, I think a better guide is to look at the research. And there's plenty of research out there. Look at the research, and which I think has guided the decision that's been made today. I think you've made the right decision in terms of the level of care.
I think I have the perfect solution, and that is that we need to organize a massive hunt for a lamp with a magic genie in it.
Okay.
In
time in rural areas, have you looked at the community paramedic model? Like if that saves a lot of money, how that decreases transports when we go to patients' home, all that?
So she's talking about something that's being tried around the country. It's called, by various names, it's called mobile integrated health. It's called community paramedic. Essentially what it is taking EMS providers, giving them some additional training in which they provide some home visit kind of primary care stuff. They also do some triaging of patients that may today go to the hospital and may not go to the hospital. Some models are really working toward trying to reduce readmissions. Hospitals now are punished financially if they discharge a patient and the patient then comes back. And so they're using community paramedics to take care of, go visit these people and ensure that they are compliant with their medication and wound care and all of those kinds of things. So it's an idea and model that has lots of promise, especially in rural areas. We just have not found yet how to pay for it. It has not been structured. There's been a few systems that have done some great projects. The Reno system got a grant from a $10 million grant from the government to test it over the last several years, and has proven that community paramedics save significant healthcare costs. Now we need the system to catch up, figure out a way to reimburse it. So Joe has been on the front edge of that here in Fremont County and has modeled it and done sort of a pilot study of using community paramedics in the Du Bois area, and was successful, but we just don't have that financial stream. So here's my recommendation. My recommendation is keep working at it. It's something that's going to get sorted out over the next few years, and when it happens, Fremont County is a perfect and important area, especially with sort of the healthcare statistics here.
Excluding the awesome idea of finding the genie, which I agree with, I think that we need to have the community come through and support us while we go and explore the further options of going into privatization, instead of just rushing in there, going half blind into a situation and not coming out with the best end results for Fremont County.
Thank you. Does anybody else have any comments that you would like to offer to the commissioners that are here? Any suggestions in terms of moving forward?
The commissioners talked about, sending information out when it comes to a tax-based deal, whether it be off of a mill levy or a sales tax. One would be if you guys could also send out the info so that people in the county know where that money's coming from and then going. So, if you run off of like a property tax, then it is just the people in the county that are paying for the subsidy of the ambulance, versus if it's off a sales tax, then the guy who comes down from Thermop to buy his groceries at Walmart, if he wrecks in the canyon, he's already paying a portion through sales tax for that ambulance service.
One idea that we're looking at right now is putting together what we're calling, I guess, a fact sheet, if you will. We don't have it together yet, but it is an idea that we're putting together as part of this survey that Commissioner Allen was talking about, so that you're more informed of some of these decisions that need to be made. Will this fact sheet include everything? No. We kind of were chatting about it, Commissioner Allen and I. We figured almost 10 pages, and quite frankly, nobody's going to read 10 pages. Somehow we need the condensed version, a one-page form, so that everybody understands. We're not there yet.
I can dispute the myth that the property tax base is only made up of local taxpayers. 70% of our tax base is made up of mineral taxation, which basically is subsidized by out-of-staters. So when we talk about funding county government in general by property taxes, over half at least is is provided by folks that do not live here.
Great.
I apologize for getting here late, but it appears to me that you have a revenue issue. So how is it a private system going to be less costly to provide this service than the public system? It looks like you got X amount of labor that's required and X minus a significant number of revenue.
Yeah, so what we were talking about was actually the pot of EMS revenue is fairly large. And when we talk about an integrated system that uses all of the transfers going out of the hospital, which are now being largely done by the air medical services, and so a private company, a private air medical company, would be interested in taking over the ground operation, probably under the chance that they can enhance the business that they're doing now. They might be able to do more flights, and they also may be able to get a lock on the entire transfer business instead of as it is today with a competition between two flight services that you have here in Fremont County. We think the flight revenues out of Fremont County are somewhere between $8 and $20 million. Whereas you're talking about a ground ambulance service operating optimally here will cost, the 911 system will cost about $4.5 million.
So out of the air system, how much of that is billed versus paid? My mother, this last summer, she flew from Worland to Casper, $44,000. They collected Medicare. Wasn't close.
Right. So, yeah, you want to speak to that?
My name's Matt. I'm program director for Guardian Flight, and I might be able to help a little bit here. The bills for air medical are high. They're up there high. You got to remember that the reimbursement for us is very similar percentage-wise as it is for ambulance, and the overhead is great. So we fly $4.5 million helicopters. Our annual maintenance on that is about $300,000 a year. So to make up for all that revenue is why we bill high. So if we have a self-pay patient, say the ambulance brings in a patient that doesn't pay, or what we call a self-pay, and we fly them out, it's a self-pay for us, and we don't reimburse on those either. So to say that we bill this much and that's the much revenue we get is a kind of, it's not really true. We don't get all that revenue. Medicaid, we get a certain percentage, just like the ambulance. We'll bill $42,000 or whatever. We're only going to get 30% or 25%, whatever Medicaid sets up. So just to kind of clarify that a little bit.
Yeah, you wouldn't have two of them here, two providers here splitting 50 transports a month if there wasn't significant revenue. So what we talked, I think, before you got here was we talked about the fact that the 911 system is not sustainable, and we were really talking about a system design that actually cost shifts, uses the transfers to actually subsidize the 911 thing, and so that was where we were seeing that meeting that revenue shortfall. Make sense?
The biggest shortage in society is capital. That's money. And we've got to figure out a way to do it more efficient, because you're not going to ever have enough money for government.
One last question for the commissioners and Scott, I guess. One, how much is in the hospital fund from the sale of the old hospitals? Does that collect interest every year, and has that been accruing as well? And finally, why couldn't that be used? It's cash on hand if we believe this 24-month thing can actually happen.
The county has about $8 million in reserves right now, which could be used, if chosen to be used, to subsidize. Well, you know, the hospitals were sold 35 years ago, so I'm not sure that dollar from that sale is here today, but we have not gone below $7 million for years in reserves. So we got out of the business of calling it the hospital money years ago. It's just reserves, and it stands at about $8 million. The sale, I think, was close to $8.5 million, and I think the reserve that they that we kind of pinned that on was about $7.5 million for years. And we've had reserves in upwards of 10 million, and it's gone down to below 7 million. We've built it back up, so there's money there to subsidize this for 2 years. We never used it, so.
So, any other comments? I hope this was helpful. Bring a little bit more light into what's going on. Good. Really appreciate your participation. I'll be hanging around here. If you would like just a brief summary of what we talked about, and there's a few things here that we didn't talk about, but just a 3-page summary of our recommendations and findings. And again, this month the full report will be coming out and be made available. So thank you, and good luck.